order. I'm kind of looking at Louise. So if Louise doesn't mind going first, to feedback from her table, which is primary care and dentistry, please. So just a couple of minutes about what you've kind of come up with, please.
Great. I'll talk a little bit about the just general discussion areas. Some of the messages we came out with, courtesy of Meg, we said reforms are actually deforms. Reforms cost money. We've reformed twice in the last 10 years, but it hasn't improved things. And we looked at different broken models now compared to Europe for primary care. We're spending half compared with other European nations. We also looked at poverty and deprivation. We're saying we spend 30 billion less, but we're actually not addressing either poverty or deprivation. We mentioned that extreme insurance from the US, insurance schemes drive up costs. And possibly social insurance is actually antisocial because it excludes people. And finally, for primary care, we mentioned privatisation by stealth. GPs are being taken over, so there's NHS badges and NHS masks, but behind that are private corporations and hedge funds. Then we moved on to dentistry. And we looked at how the whole contract needs reform. It doesn't work for the patient, particularly emergencies. There's limits to contracts. We also mentioned that prevention helps other health issues and conditions such as obesity, heart disease. There should be a focus on diet, not brushing teeth in schools. There's actually no funding for schools. No health checks equals no knowledge of problems. But we looked at the disaster in care homes. Low funding means low equipment, low care. And the government is providing funding, so they're commissioning volumes, not commissioning need, so it's perverse incentives.
Thank you very much. Thank you, it was really good, really good informative feedback there. Emergency services and hospital care, who's got that please? Fantastic.
The first question was, the NHS is getting... The NHS is getting more money than ever before was the first question. And the areas we discussed were to bear in mind, if you're dealing with that question with the public, is firstly the population itself has actually increased. Oh, alright. Firstly the population itself has actually increased, so I don't know, I just kind of made up the figure really that in 1948 there were about 50 million people in the country. There are now something like 65. So obviously more money is needed. You would hope you'd get that for that reason alone. But also there's an increased need within that population as well, and that is also to do with the what I call the rate of almost scientific development, because there's a bigger range of treatments now available, and also the perception that you need treatment has developed, obviously, once you had a National Health Service. And one of the questions was, well, where does that money actually go? Is fairly fundamental there. Then the second question was, the NHS is just a black hole that swallows money. And we didn't get very far there, because in a sense the first two questions tied together. But we talked about the Blair Brown government, falling government in waiting lists that came down during that time. So it's, you know, what do they mean by black hole really? And then the last question was, the NHS model is out of date because it produces poorer outcomes than other models of care, such as insurance-funded systems in Europe. And they're the kind of things we raise, the questions of poverty, poverty in Britain specifically, perhaps also, well, definitely connected to 14 years of austerity. The fact that in the UK we have lower life expectancies, and that actually that age of life expectancy is going down. We specifically mentioned cancer outcomes, cancer care, and that's often to do with a lack of staff in the UK at all levels, from oncologists, consultant level down to nursing staff. And for example, finally, we spend 18% less than Germany and France on our health system.
Crisis in NHS staffing. So the big thing is we don't value, or we value, but the government doesn't value the staff. The pay is down, but you can get more in the private sector. There's a 10-year real terms pay cut. 5% of staff, this is in East Kent Health Trust, 5% of staff in that trust leave every month, and at the moment there's a vacancy freeze there, so that's terribly dangerous, and they've also been downgrading their staff, so morale is at rock bottom. There's increase in sickness, and the public perception, they don't understand that there are no staff to look after them, so then they get moaned at because bedpans are late, dinners are late. So people are actually getting a bit of a message when the media state about PPE and test and trace and the vast waste that ensued, and that should have gone to paying the staff. We've also got issues like Virgin are suing because they haven't got contracts, and that costs a lot of money. That could have gone to staff wages. We've had cyber attacks, so that's going to cost money. And then we turn to the subject of physicians associates and nursing associates, which are taking jobs from GPs, doctors and nurses. These people are slightly cheaper, not a lot cheaper, but they are dangerous, they're unsafe, there's been fatalities, and the government can say that we employ more or there's more on the GMC register, there's more on the nursing register, because they include these people in the figures, they're being manipulated. We've seen a lot of emigrations this year, and we've seen a lot of inexperienced staff, which obviously makes things a lot more dangerous for the patients. There's moral injury to staff because of the stress when you're left short-staffed and you're inexperienced. Student funding, well, people come out of colleges and universities with huge debt, and because of the physicians associates and nursing associates, there are no jobs for properly trained doctors and nurses, and this is encouraging a two-tier health service. And then our message to the incoming government, to West Streeting. He takes money, as does quite a few of the Labour MPs, he takes money from private healthcare companies. That's got to stop. And he needs to make policy for the benefit of the population rather than him and his cronies. So that was the starting crisis.
I think I need to turn around completely and go over there. That'll be better. That's all right. So our question, first question, this is about maternity. The NHS is getting more money than ever before. One of our first responses was, no it isn't. The next one was, a lot of it goes to private companies. Health is priceless, and also remembering the question, the NHS is getting more money than ever before, but not enough. And a quote from Nye Bevan, from one of our members, the money is there in society. And if there isn't any money, why are private companies so interested? So, okay. Now, the next one was, there's no evidence that the NHS is being privatised. So, we felt that that was probably less of a question nowadays. People seem to understand, but anyway. We said, and this is about maternity, remember, it's stealthy. People find their own scans and doulas and private midwives. Then we pointed out that difficult cases are sent back to the NHS. And one of our members mentioned private doctors don't go private to have babies. And then we thought we could use WeOwnIt statistic. We've lost 10 million a week to profit since 2012. Okay. Finally, our question was, we're running a national sickness service. So, we came up with, old doesn't equal ill. A healthy population makes a healthy economy, based on the speaker earlier. Staff cuts cost lives. Rich people can afford care, poor people can't. And this is maternity again. It starts before the baby. Sort out economic deprivation. Deprivation causes sickness. Cuts cost lives and compensation. And then finally, you can't put a price on your child's life. And that's us.
Thank you very much. Social care, please. Social care?
Social care, a few messages. One of the first ones was we need to tell people what social care is. Lots of people actually don't realise it's mean tested until they have to come to pay for it. So we need to make the difference. You know, we hear about the NHS being fighting privatisation, but social care has already gone almost entirely to the private sector. So we have a slightly different battle on. Privatisation, I don't say this to these people, of course, leaches money out, which we talked about, but also I think Carfrey talked about, it makes it less accountable. And somebody said, why are we giving our money to councils to just dish it out to these private companies? We have no idea what's happening with them. Privatisation also fuels institutionalisation because they build big homes, often far away from where people live, because it's economical and they can shift stuff about between buildings, and that also improves their profit. So we're very anti-institutionalisation and social care disgrace campaign, and I see institutionalisation not just as about putting people into homes, which most of us don't want to end up with if we can help it, but about the kind of care that's delivered in people's own homes, which is this run out physical needs, toilet, food, this. You get your tea at 6 o'clock, even if you actually tick a box to say, I really normally like to eat at 8, and I like to go to bed at 10, not 7 o'clock when the staff can fit it in. That is not, acceptable. So we don't want the other message to say to Unison and Labour as well. Lots of talks about a national care service. That's going to solve everything. But I think they don't see it as we see it. They see it as tweaking the system that we've got now, and possibly letting the local authorities pull it, take it back over from the private sector. But we don't want the same stuff run by, the same stuff, but different people running it. We want something radically different. We want a system. We need to say to people, we need to start by rethinking it all together and saying, what do we want for ourselves, our children, our relatives, ourselves in our old age, younger working people. Talk to people, work with them, what kind of system do we want? And it's got to be something very radical and very bold. It's got to be community-based, small scale. It requires looking at a whole set of services together, like housing and everything else, community services. So it affects all of us, and I think that's another strong message we didn't discuss much today. But social care isn't about people over there, but disabled people. It's about all of us. Most of us are touched by social care at some point in our lives, either looking after other people or facing it for ourselves. So we need to get the universal message across. And people also raised, of course, the situation of care workers and having care workers who are not well trained sometimes, terribly badly paid. And we didn't even get into the care workers from abroad, who were some of them living in nice slavery conditions. And this is being made a priority by Labour. But, it's in a sense, it's an easy win for them. Instead of thinking radical, thinking bold, they're thinking, well, we can up the pay of care workers, and that'll be all right for our first term. So we'd like to go further than that. I think that's probably about it, is it anyway?
Thank you very much. I've got privatisation and defunding, please. Who had that? Tony. We are it's my fault really, but we are a little bit over. So last two tables, to be nice and quick, please. Thank you.
Okay, first question, we can't afford to spend more on the NHS. The first answer was that we're one of the richest economies. Secondly, we can't afford not to spend more on the NHS for the reasons that we've discussed elsewhere. The third thing was, greatest funding does not mean adequate funding. the reform, the NHS needs reform, not more money. One of the things was we were being nice to the questioner. We were saying, oh yes, of course the NHS does need reform. And in fact, you start to lose ground then by, for example, the person would come back and say, okay, what reforms does it need? So we were trying to rehearse the saying, the question that it's when it was funded properly, it was the best, and it's not an issue of reform, it's about funding and related issues. We didn't spend as much more as much time on that as we should have done. No, there's a privatisation. Some good answers. It's not privatisation. It's not just about patients paying for their care. It's about inroads being taken into the NHS services and also private infrastructure. So John from the East Suffolk and North Essex Foundation Trust talked about privatised ownership of MRI scans, where the capacity in the NHS is then private and it costs more and it's out of control of the NHS. That's just one example in his area where the threat is outsourcing. The other important point was companies come and go, their interest is in profit. If they don't make enough profit, they go, or as in the case of Carillion, they go bust. The other point was privatisation does exist and it undermines training and all those things. One of the key things sort of already been said, we earn anything about £10 million a week, that's a good one. So these were not so much about no evidence of privatisation as the damage of privatisation, cherry picking, no ITU care, Oxford University research saying that it's damaging. And if you're talking about cherry picking, you should have an example up your sleeve of how that cherry picking can be damaging, such as cataract surgery.
Way mental health is the Cinderella servant, as you've seen today. So ever since the inception of the National Health Service, it's been a Cinderella service in terms of funding. It doesn't swallow money. That's quite an extraordinary dystopian question to ask people, or for people to make that point. Even Norman Lamb, when he was Secretary of State in 2011, said he was going to fight for parity of esteem for mental health provision, and if you follow the money, we've got nowhere close. The second point about running a national sickness service, well, even if any media outlet that you might read will tell you there is a very significant mental health crisis in this country for all ages, but particularly for young people and adolescents, and also for older people, but everybody in between. And that really relates, as we felt, and the messages to get out there relate to the information all three panel speakers gave us. But our particular message will be in relation to mental health is you've got to catch people before they fall. You've got to invest upstream, and then you can have some impact on the health of the nation. And if there's no evidence that the NHS is being privatised, just follow the money. I think John Bosco, Martin and, sorry, it's got blank. Martin and John gave us plenty of evidence that if you follow the money, that's absolute crap. Thank you.